Welcome to ILTV's Israel Daily. I'm Aaron Porras, and coming up in today's newscast, Israeli health experts warn that hospitals will exceed maximum capacity by the weekend as coronavirus infections continue to pick up speed. Prime Minister Benjamin Netanyahu and Finance Minister Katz announce a massive new stimulus plan, including cuts to government pay. And meanwhile, Tel Aviv-Jaffa gets set to become the first city on Earth with a network of smart roadways. Stay tuned for more about this incredible pilot. "800 seriously ill patients. That is the current maximum threshold that's been given for Israel's hospitals, indicating full capacity. And health experts are warning that Israel will exceed this capacity by the weekend. Nittany Manson reports.
In a Zoom meeting Monday, health experts, hospital officials, and coronavirus authorities laid out the bad news for Israeli ministers. Hospitals are quickly nearing capacity, projections of exceeding the 800 severely ill maximum by week's end, and reaching double that within 3 weeks.
Right now, we are facing an increase in the numbers of patients admitted to the hospital. Some of them are in critical condition, some of them in a severe condition. And yes, we are looking forward for the next few days to a week concerned regarding the increase in numbers. We might be facing totally different numbers and totally different atmosphere in the hospital, and we are preparing for ourselves for this situation.
And in line with these predictions, upwards of 1,200 deaths are estimated to be reported by November this year, with 20% of seriously ill patients ultimately succumbing to the virus, and infection rates holding at nearly 11%. In fact, nearly 4,000 new infections have been recorded again in just the past 24 hours, out of less than 40,000 tests. The total number of active cases now rising to over 51,300, serious cases rising to 668, and the death toll hitting 1,285. The Israel Defense Forces then, under orders from Defense Minister Benny Gantz, having begun establishing field hospitals to contain hospital overflow, while the government coronavirus cabinet discusses additional and harsher restrictions. But average Israelis just seem confused and hurt over the lack of clarity in the ongoing closures.
A lot of people going to work. We open for takeout and delivery, although we don't know if it's okay or not, because it's very difficult to stay closed that long. We hope it will be effective. This is what we can do.
אני חושב שזה מיותר, כי בסוף כל מי שרוצה בעצם יוצא, בגלל תמיד, כאילו, יש כל כך הרבה תירוצים לגיטימיים. אפשר להגיד שאתה יוצא להפגנות בבלפור, אפשר להגיד שאתה יוצא כמו שיש שם כל כך הרבה תירוצים לגיטימיים, שבסוף הסגר הזה פשוט לא אפקטיבי. הוא לא ייתן שום דבר.
Meanwhile, leading politicians seem to be spending more time playing the blame game. Knesset member and coronavirus committee chair Ifat Shasha-Biton now blasting Prime Minister Benjamin Netanyahu for implying that today's infection rates lie on her shoulders. Shasha-Biton going on to explain that all her actions have been transparent and made with consultation, as opposed to 2 of Netanyahu's own aides who were spotted breaking quarantine multiple times in recent weeks. And in fact, COVID czar Professor Roni Gamzu is now calling for legal action to be taken against these aides after they broke quarantine following their return from the United States. Netanyahu, for his part, is resisting pressure to fire or otherwise punish the pair, saying they should just pay a fine instead.
Now joining us with more on the recent closures then is Israeli police spokesperson Superintendent Mickey Rosenfeld. Thank you so much for being with us, Officer Rosenfeld. Now, we are now almost a week into the closures. How would you rate the public's participation?
Well, in general, I can confirm that the public is keeping the rules and regulations of the COVID-19 government decision, which was made just before the new festival of Rosh Hashanah, the New Year festival. As of now, more than 7,000 police officers are involved in activities across the country, both in Jerusalem, in Tel Aviv, and in all different areas in order to enable the lockdown to take place and prevent the movements of the public as much as possible. And all of this in a joint effort and a public effort to keep the number of COVID-19 confirmed cases to a minimum. As we've seen, unfortunately, over the last 24 hours, the numbers reaching a new peak high of more than 4,000 to 5,000 confirmed cases. And that is causing a lot of tremendous amount of responsibility and also heavy weight on the hospitals, both inside the wards. And that is something that we're dealing with at the moment.
Where are the biggest problem areas? What areas are you having maybe the most difficulty enforcing the restrictions?
Well, in general, the majority of the public understand the seriousness of the situation, and of course, a 3-week lockdown is a last and important step and stage that we're taking in order to take full responsibility, both the Israeli government, the Israeli National Police, as well as, of course, from the public, to carry out all the safety measures as possible. We know that the public realizes that the numbers are very high. We know that across the country, there is only a minimum amount of movements, as within the last 4th day, which in fact we're in at the moment. Police units are patrolling all different areas, both inside cities, both on foot, both patrol cars taking place in all different communities to get the message out so that people will understand that we're at a critical stage at the moment in dealing with COVID-19. Otherwise, within the next 2 to 3 weeks, we're going to have thousands and thousands of people in the hospitals, arriving in hospitals in a much more severe, serious, and in fact critical condition. And we're doing everything possible to prevent that from happening.
Well, by what method are you actually conducting this enforcement? Because, how do you ensure that someone is staying 500 meters to their home? Because if I step out 600 meters, is that going to be, a finable offense?
Well, in general, we have to understand it's the public's responsibility. People are allowed to walk within 1,000 meters of their homes. Our police units are on foot in order to question people, approach people, make sure that they're keeping social distancing, making sure they're wearing masks, making sure that we have enough police officers at the right place at the right time. Our roadblocks are moving from place to place from time to time in order to make sure that the public are seeing officers at the different areas. We are also giving out fines to anybody who is not keeping the rules and regulations. Just over the Rosh Hashanah festival, we gave out 4,000 fines for people not wearing masks and being in public places which they are not allowed to be in. And therefore, we're specifically calling upon the public to keep those rules and regulations. There might still be a future government decision, a cabinet decision, which will even have tighter lockdowns, which the Israeli police will have to implement.
All right, now you just mentioned handing out fines and enforcing certain restrictions, but 2 of Prime Minister Netanyahu's aides who actually went with him and returned from the United States recently have been spotted breaking their 2-week quarantine. Who decides whether or not to take action against them?
Well, that is an unfortunate incident, an irresponsible incident that took place. That type of behavior from not just a government official, but from anyone is unacceptable. And of course, someone on that level should be giving a responsibility and an example of what has to be done. Our police units are also patrolling different areas and visiting people that are in self-isolation to make sure that they are in fact inside houses. We're also visiting people that have confirmed COVID-19 and that are inside the hotels and other areas. It's an ongoing effort, which is not just a short-term effort, but a long-term effort by our units, patrolling, walking around, risking their own lives as well. But that is something that we have to do in order to make sure that together we'll be able to take control of the situation as soon as possible. Let's not forget that the results and what we're seeing now taking place in the hospitals is due to the fact that people met and got together at weddings and public events, and only a week or 10 days later we're seeing the numbers at the hospitals where unfortunately so many people have now been taken for treatment.
All right, Superintendent Mickey Rosenfeld, Chag Sameach, Shana Tova, thank you so much for being with us. Now, in the meantime, with a flood of new coronavirus patients, Health Ministry Director General Chazi Levi is further tying Israeli doctors' hands, ordering all hospitals to immediately suspend all elective non-essential surgeries. Levy explaining that the healthcare system must act as if it's already in an emergency situation and redirect all resources. Hospital directors are pushing back, though, arguing that the order comes in spite of the importance of elective surgeries to hospitals maintaining financial stability, and especially mid-pandemic, when such surgeries are considered a key source of funding. But that's not all. Health experts are pointing out that many elective procedures are still life-saving, including hip and back surgeries, and that this order will likely cost more lives than it saves. With us to further discuss all the new regulations and the impact on the healthcare system, Dr. Yakir Kaufman, the head of the Standards and Regulations Department within the Medical Directorate of the Israeli Health Ministry. Dr. Kaufman, thank you so much for being with us.
Thank you for having me.
Of course. So now let's start off with the choice to cancel all elective surgeries for now. What impact is this going to ultimately have on the public, on hospitals, and on coronavirus treatment?
Well, first of all, it will allow us to contain more COVID-19 virus patients. We'll have to be, now we're opening more and more wards and units, intensive care units, and we'll need that because of the rising number of people with a positive for COVID-19 and for people in severe and intermediate situations in terms of their morbidity. In terms of the elective services, of course, we'll have to postpone some of the surgeries and procedures. Urgent issues that are not COVID related will be treated, of course. Everyone that needs urgent treatment will get urgent treatment or even semi-urgent treatment as much as we can. And also these closure of the wards or unit that are not COVID will also be done relatively gradually. It's a process. It's not something that you do. It takes a few days to open new wards, and it will be done quite quickly, but it's still a process.
But is this really the right move? Because isn't there maybe always room for at least some elective services? And for example, again, there are many doctors who, aside from the health professionals, really, who aside from the financial aspect, are saying that things like a hip or a spinal surgery, which may count as elective, is still life-saving.
So any life-saving procedures will be done. That will not be postponed. Again, there's no way that we treat people who need help with COVID, but will endanger people who need immediate and urgent health. So all that will be continued. Any life-saving procedure, even if it's semi-elective. And again, as I said before, it's a process. Will take time. It's not that you close everything down immediately. It's a gradual process. You close one ward and then you open it for COVID, and then you contain, when it goes up to 80% the occupation level of that unit, to open another unit. So it's not all at once immediately. It's still a process.
All right. Now, what are the biggest points of infection for coronavirus? Are we talking hospitals or schools or synagogues, in the home, the supermarket?
Well, the main infection is usually due to people crowding together. The highest risk is crowding together in closed areas within homes or within crowded areas indoors.
So are the restrictions properly addressing this, though? Because again, we're going to still have people when they go for essential services, like when they go to the supermarket or to synagogue, even in that small crowd, or at the home when you have large family units. Are these restrictions really addressing that?
So we had weddings with hundreds of people, even more than thousands of people. That will be stopped. Big crowded gatherings, either religious or non-religious, either family-oriented, will be banned, and people will only get food from essential stores and so on and so forth. So a lot of the traveling between towns and cities will be reduced. So big gathering will not be able to be done. Synagogues will be limited to 10 inside and 20 people outside, again with social and physical distancing, 4 meters for each person, again with masks, of course. So there will be a lot of limitations, and this will reduce the number of people that will be infected by the COVID-19.
All right, Dr. Kaufman, thank you so much for taking the time to explain that with us. In other news, taking its toll on more than just our sanity, Israel's second coronavirus lockdown is doing unprecedented damage to the economy. Israeli Prime Minister Netanyahu and Finance Minister Israel Katz then are announcing the passing of another stimulus package. In a late-night session on Monday, the Israeli cabinet announced the passing of yet another economic safety net designed by Prime Minister Benjamin Netanyahu and Finance Minister Israel Katz. And the expanded plan, costing an estimated 10.5 billion shekels or $3 billion, will primarily go to help businesses, the self-employed, and wage earners, who are now hurting the most from the current lockdown. In just the 4 days since the second lockdown began, nearly 42,000 Israelis have registered as unemployed and looking for work, the majority of whom have been pushed into unpaid leave. And this bringing the current number of jobless in Israel up to 779,737. Hundreds of businesses and indeed whole industries being shuttered for the coming 3 weeks in efforts to contain the still spreading coronavirus outbreak. But maybe the biggest surprise in the latest economic stimulus comes in the form of a 10% cut to the salaries of Knesset members, ministers, the Prime Minister, and other office holders whose salaries exceed that of an MK by 10%. Prime Minister Netanyahu explaining that, quote, "We all have to stand together and bear the burden." And finally, in addition to unemployment benefits and loans for small to medium businesses, the plan also includes aid to boost the healthcare system and to special needs care. And now to expand on the details behind the newly announced 10.5 billion shekel relief plan, ILTV contributor and consumer behavior expert Dr. Vili Abraham joins us. Doctor, thank you so much for being with us.
Pleasure.
All right, so what exactly is in this plan?
So we're talking about 10 billion shekels. Most of it will be given in the form of loans to support businesses. Another billion shekels to equip hospitals and to reinforce the health system, and 1 billion shekels for special needs care.
Well, how many people qualify for the loans, and what's the interest rates like? What are the long-term ramifications of?
Well, the interest rates are very low. I mean, if you compare them to what you get in a bank today, it's really low. It's subsidized. But the thing is that we have a lot of unemployed individuals. If you look at the unemployment rate before the second lockdown, it was around 500,000. So we're talking about 11.2%. And the question is, how much will it do in order to bring down the unemployment rate, which only increased after the second lockdown went into effect?
So that actually is the question. How much is this going to, help those who need it most? Because as we've reported and as we had something like 40,000 people just in the last 4 days register as unemployed.
Yeah, well, the thing is that if you look at the restaurant business, for example, so they're allowed to, deliver food. But the problem is, with the business owners that I've been speaking to, and I've been doing it a lot lately, they have to close down because it's just not worthwhile for them. They can't cover their overhead costs by just doing deliveries.
Yeah, deliveries aren't
many
covered.
of them, yes, they're just, putting their workers on leave, unpaid leave.
Because that costs ultimately less than just having a couple of workers and sending deliveries?
Sending deliveries is a very expensive business because you have to have motorcycles and insurance, and the whole process is very, very expensive, and it's a lot cheaper if you look at the operation costs to have people come and sit in your restaurant. You're able to serve more people per hour.
But it's cheaper to shut down as opposed to take on some of these costs even with third-party sellers like Wolt or Tendies?
Exactly, because you cannot cover your fixed costs; they're just too high.
All right, so how best can people maybe take advantage of some of these loans and some of these benefits that are being passed in this stimulus and previous stimuluses?
So if we're talking about business people, what they should do with the loans that they're getting, first of all, just pay off the debts that they have to suppliers, paying off for electricity and all the fixed costs. This is the first thing that they should do. Regarding the employees that they have to let go is something that the government will do. So what they have to do is just to keep afloat, and by just paying off debt in order not to be in a situation where you're bankrupt and you have loans to pay later on.
And if you're not in a position where you can pay off all of those debts at this moment, are you, SOL? Do you not get any benefit?
Well, the thing is that you are getting these loans, but again, these are loans that you have to pay back in the future. And the problem is that a lot of business owners in the future, in the very near future, they'll find themselves, overwhelmed with loans that they have to pay back. And they'll have two options. It's either to close their businesses or to increase prices. So this means that one of the projections is that after this ends, we'll be paying more for, restaurants that when we go out and eat.
What about, maybe any sort of investments or refinancing or anything like that? Is that an option?
Yes, that's an option. So this is something that every person should do, whether you're a business person or private individual. So first of all, refinancing is a great idea because you can lower the amount that you return every month. You should also cut fixed costs. Businesses can do this by working with other suppliers that sell products for cheaper prices. And if you look at the individual person, you can cut down on fixed costs like cable and cell phones. I would also move to a small apartment or to a smaller space, if you have if a business. But the most important thing is not to be tempted by external loans that sometimes dubious companies provide, which can be very, very expensive. And most importantly, probably, is to safeguard your history, your credit history.
Wow. All right. Billy, thank you so much for coming in.
Pleasure.
In other news, Israelis across the country are doing their best to make do with the new closures. But Israeli parents are now demanding that at least their children be allowed to return to school. Israeli schools across the board have been shuttered as part of the latest lockdown, with the exception of special needs education facilities and boarding schools. But this means that many students are stuck at home trying to get by through remote learning, which makes it impractical, if not impossible, for working parents to work remotely from home as well. Arguing then that this situation has no justification. Many are calling on parents to boycott remote studies programs and force the government to reopen at least some classes where infection rates have remained fairly low. The Knesset's Education, Culture, and Sports Committee is set to discuss these demands on Wednesday, with plans to hopefully reopen some schools between kindergarten and up to 4th grade by as soon as Thursday. And now, speaking of smart solutions, the Tel Aviv-Jaffa municipality plans to be the first city to install smart roads, which will recharge electric vehicles as they drive. Hannah Rifkin with the story.
Say goodbye to gas stations because the future of travel is here. The Tel Aviv-Jaffa municipality recently announcing plans to introduce smart roads as part of a pilot project for a more sustainable public transportation system. The project will start with a bus line following an electrically charged route through North Tel Aviv, allowing the bus to recharge its electric battery as it drives. And Tel Aviv, a leading city in innovation, will be the first in the world to install these smart roads throughout its city if the trial is successful, with the municipality also considering options to add other vehicles to the recharging road roster, including trucks and cars. The project's goal is to use the technology, which lays just below the surface of the road, to cut down on air pollution and to provide a more efficient transportation system. And the central Israeli city is set to begin the trial in December 2020. So could dreams of a cleaner and greener city be in the not-so-distant future? We certainly hope so.
And now let's take a look at the weather forecast. Tonight should be clear and warm with lows averaging around 72 Fahrenheit or 22 degrees Celsius. Then tomorrow you can expect clear and sunny skies again, but with a slight drop in temperatures for a high of around 89 degrees Fahrenheit or 31 degrees Celsius. And now, of course, before we go, let's take a look at what's going viral in Israel. I'm kind of grossed out and scared. Oh no. Oh no. That's awful and amazing. All right, that's it for today's news. Today's exchange rate is 3.47 shekels to the American dollar and 2.59 shekels to the Canadian dollar. For more news from ILTV, please like ILTV on Facebook, follow us on Instagram, and subscribe to our YouTube and Roku TV pages. I'm Aaron Porras. Thank you so much for watching.